Well, I don't know about you, but I need to take a breath standing up here, so I invite you all to do the same. So imagine you live in a small town. You never have had access to very formal education, but you're really smart. So one day, your neighbors, you decide to go into town to go to the doctor. And it turns out you have a mild infection, they tell you, but it's nothing to worry about. They tell you you should take these pills and everything will be fine. They also ask if you wouldn't mind coming back a few times, and they'll give you a little money. So that doesn't sound so bad, right? Eventually, you go back and forth. They ask you if they can take your blood, and you agree. Also, as it turns out, one of the nurses who works with the doctors, she happens to be your neighbor. She also goes to the same church with you. And so you think, this all sounds pretty good. You don't really think much of it. You go about your business, you live your life. You eventually have a family. You raise your kids, and you're all just hanging in there, going about your day-to-day life. And so sometimes they ask to take your blood. They also have on occasion asked if they could do a spinal tap on you, which you don't really understand and they don't really explain. But again, because you know the nurse and you trust her, she's a member of your community, you go along with it. And again, the money every so often doesn't hurt. You go back and forth for several years. You live your life, and you even have occasion to see doctors in the neighboring community, and they also reinforce for you that you're fine. Everything is fine. Except what started off as a mild infection seems to have morphed into something different. You're starting to have some trouble cognitively. You're misremembering things. You're starting to have trouble with your vision. Your vision is failing, and you don't know why. But you see, unbeknownst to you, a bacteria has been living in your body for years, perhaps even decades, destroying your neurological system. This is what happened in the 40 years that the United States Public Health Service and the Centers for Disease Control and Prevention conducted what they called the study of syphilis in the untreated Negro male. Many people, of course, have heard of this study. Many people think of the study as one in which the government injected people with syphilis, but that was not the case. They followed 400 black men with syphilis, 200 black men who did not have syphilis. They knew for all of these years that the men had syphilis. They gave them pills to also make them believe they were being treated for syphilis, when in fact they were not. And as a result of this, at least 28 of these men, and perhaps as many as 100 of them, died as a result of syphilis complications. It's pretty amazing to think that even this was a study, and they did not keep records well enough to know whether it was 28 or 100 men. There was a range there. They couldn't be sure. In spite of the fact that at least 28 and perhaps 100 people died as a direct result of the United States government's malfeasance, no one was ever charged with a crime. In fact, the story only broke because someone inside CDC was a whistleblower and kept going to tell people, I want this to stop, and eventually went to the press. And that's how it stopped. Eventually, the men they formed a class action lawsuit, and they received about $37,000 for their 40-year service, their involuntary participation in this study. And ironically, they were entitled to free health care from the government as a result. I was aware of this study as someone who worked at the Centers for Disease Control and Prevention for many years. But interestingly enough, the way it was talked about was sort of as an issue of research ethics, as though this was simply poor research ethics. This is why we have to, as academics, all go through IRB training now. Just a little mishap that took place for 40 years. But what I didn't realize about this study was that the purpose of it was to validate the idea that Black people are fundamentally different than white people. That was the purpose. The government wanted to see the natural progression of syphilis in Black people, believing that syphilis would progress differently in the meager brains, as they put it, of Black people compared to whites. This was why the study was conducted. And in fact, none of it was a secret. They published these studies in JAMA. But what are the implications for people who are alive today? For people who may be descendants of the men who were in this study? My chance encounter with a woman I call Tamra raised all of these issues for me. At the time that I met her, she was 37 years old. She had an MBA. She lived in Chicago. She was married. And she came to a focus group I was running about Black women's experiences in healthcare. And what she told us, what she told the group, left all of us speechless. She told us that her great-grandfather had been married and had 2 children. And then he happened to be, as she called it, he happened to be in the study. Her family told her that he had a spinal injury. Something happened to his spine, and he died as a result. And this may have been a result of the spinal taps that the US government used to stage this infection as it progressed from acute infection to latency to the late stages. She simply told us, they killed him and they sent him back in a box. They killed him and they kept it a secret. And that is the story all of my elders will tell you now. As she told this story, it became increasingly clear to me that what happened to her great-grandfather had implications for many generations of her family. It wasn't just for the people who were alive at the time. And that is something I think we don't think about as social workers, as human beings, that the history is living with us all the time. You see, Tamra's grandmother and her mother had taught her to avoid being treated by white healthcare providers at all costs. For fear for her life, she had been trained, she had been conditioned to only seek health care from Black providers, if at all possible. And she carried the weight of this with her every day. She told us a story about her then 11-year-old daughter who came down with what Tamra thought was just some food poisoning. She thought her daughter was malingering and complaining, but it turns out she took her daughter to the hospital after her daughter wouldn't stop complaining. It turns out that her daughter, who was then about 11 years old, had an acute appendicitis, and she needed to have her appendix removed. Except that evening in the emergency department, they did not have a Black surgeon. And Tamra refused to consent to allow her child to have surgery. Eventually, they found a Black surgeon. She protested and protested. They found a Black surgeon, and her daughter was okay. But even in retelling the story, Tamra carried the weight. She worried that she might have made a fatal mistake. What if she had not allowed her daughter to be treated and her daughter died? But the fear was so real, was so palpable, Thank goodness all of this worked out for Tamra and her child. But her story reminds me, as a social work researcher, as a human being, that the history of research is not always sanitized, that research has often been violent, and yet the violence is washed away in the name of scientific method, objectivity, and knowledge production. But the question remains, on whose back is this knowledge produced, and who benefits? Tamra's story also reminds me that the past is not in the dustbin of history. It is now. The past is often prologue. And it also reminds me, again, I'm a researcher, I'm a scholar, I love to throw around terms like structural determinants and so forth. But it also reminds me that the structural violence that we see, that we experience, is not only at the hands of, that structural violence is often state violence. That's what I want to say. And we often overlook the violence that the state is enacting, particularly, I think, in our roles as scholars and sometimes as practitioners. For example, what of the state violence of the state of Michigan, who knowingly poisoned their children with lead in the water supply? None of those people will ever be prosecuted. This is violence, make no mistake, and it has long-term and intergenerational consequences and harms. We have to ask ourselves, I would like us to ask ourselves, as human beings and as researchers, what is our role in perpetuating harms? For example, when we're conceptualizing our research, do we think about the child who has behavior problems in school? Do we think about those problems as only being their problem, their fault? Or do we, for example, put the responsibility of that back at the rightful owner in the case of Michigan, in the case of many school systems, many societies? Do we think about the violence of cutting food stamps in the richest nation in the world, to not provide food for people, to not provide food to school children who are in arrears on their school lunch plan? This is ridiculous, and it is violent. These are critical questions of both violence and also the possibility of reparation. So in closing, I'd like to ask you again to imagine that you're a young person now, in the present, and you're wondering if you should trust your teacher or trust your healthcare provider, if you're fortunate enough to have one. Should you trust the institutions around you? Can we imagine, given everything we know, everything that's happened in the past and in the present, that we have a deep responsibility to our fellow human beings? What do I owe you as a human being? And what do you owe me? Finally, Tamra, the men of Tuskegee, the people of Flint, and so many others demand that we consider our role in inflicting harm, as well as to consider how we might move forward together toward reparation. Thank you.